Hello everyone. This is the second part of the tuberculosis video, where I will cover the complications, diagnosis, and treatment of TB. Pulmonary complications of tuberculosis include massive hemoptysis, cor pulmonale, fibrosis or emphysema, atypical mycobacterial infection, lung or pleural calcification, aspergilloma or chronic aspergillosis, obstructive airways disease, bronchiectasis, bronchopleural fistula. Non-pulmonary complications include empyema necessitans, laryngitis, amyloidosis, Ponson's polyarthritis. On a chest X-ray, the classic signs of tuberculosis include upper lobe infiltrates with cavities. Additional findings may include lung collapse, calcifications, and pleural effusion. Sputum staining is a crucial diagnostic tool for tuberculosis. The first and most important step is performing direct microscopy on a sputum smear. If the smear is positive, it provides enough evidence for a presumptive diagnosis of TB, allowing treatment to begin while further tests are conducted for confirmation. If the patient is unable to produce sputum, it can be obtained through other methods. One option is induction with nebulized hypertonic saline, which helps stimulate sputum production. Another method is performing a bronchoscopy with lavage. Sputum culture is required for definitive diagnosis of TB. To diagnose extrapulmonary tuberculosis, TB, tests such as fluid examinations of cerebrospinal fluid, CSF, acidic fluid, and pleural fluid are performed to check for infection. Tissue biopsies from affected organs or lymph nodes, along with liver biopsies if needed, help confirm the presence of TB bacteria. A full blood count helps evaluate anemia and white blood cell count, while C-reactive protein and erythrocyte sedimentation rate indicate the level of inflammation in the body, which can be elevated in TB cases. Additionally, tests for urea and electrolytes assess kidney function, and liver function tests are critical for ensuring the liver can tolerate anti-TB medications, as these can sometimes cause liver toxicity. The standard initial treatment for active tuberculosis, TB, is a 4-drug regimen known as RIPE therapy, which includes rifampin as one of its key components. Rifampin works by inhibiting bacterial RNA synthesis through its binding to RNA polymerase, effectively halting the growth of Mycobacterium tuberculosis. While it is an effective treatment, it can cause side effects such as hepatotoxicity, leading to liver damage, and may result in orange discoloration of body fluids like urine and tears. Patients may also experience flu-like symptoms, and it's important to note that rifampin is a CYP450 inducer, meaning it can interact with other medications by affecting their metabolism. Isoniazid. Isoniazid is a crucial component of the RIPE therapy for active tuberculosis. It works by inhibiting the synthesis of mycolic acids, which are essential components of the bacterial cell wall, thereby disrupting the integrity of Mycobacterium tuberculosis. Common side effects include hepatotoxicity and peripheral neuropathy, the latter of which is often due to vitamin B6 deficiency and can be prevented by co-administering pyridoxine. Additionally, INH can lead to drug-induced lupus in some patients. 3. Pyrazinamide. Pyrazinamide is another important drug in the treatment of active TB, although its exact mechanism of action is not fully understood. It is believed to inhibit mycobacterial fatty acid synthesis, which is critical for bacterial survival. Side effects of PZA include hepatotoxicity, hyperuricemia, which can potentially lead to gout and arthralgias, or joint pain. 4. Ethambutol. It functions by inhibiting arabinosyl transferase, an enzyme critical for mycobacterial cell wall synthesis, thereby compromising the structural integrity of the bacteria. Notable side effects of ethambutol include optic neuritis, which can cause red-green color blindness, and peripheral neuropathy. RIPE regimen dosing schedule. The RIPE regimen follows a structured dosing schedule. During the intensive phase lasting 2 months, all 4 drugs, rifampicin, isoniazid, pyrazinamide, and ethambutol are administered to aggressively target the TB infection. Following this, the continuation phase lasts for 4 months, during which rifampicin and isoniazid are continued based on confirmed drug susceptibility results. This phased approach ensures effective treatment while minimizing the risk of drug resistance. Monitoring and supportive care are crucial components of managing patients on RIPE therapy for tuberculosis. Liver function tests should be conducted regularly, particularly for patients at higher risk of hepatotoxicity, such as those who consume alcohol or have pre-existing liver disease. Pyridoxine, vitamin B6, supplementation is recommended for patients receiving isoniazid to help prevent peripheral neuropathy, which can arise from vitamin B6 deficiency. Additionally, visual acuity testing is important for patients on ethambutol, as there is a risk of optic neuritis, which can lead to vision problems, including red-green color blindness. Regular monitoring and appropriate supplementation can help mitigate these risks and ensure the safe and effective treatment of tuberculosis. Thanks for watching. For more videos like these, please follow us on YouTube.